Hey everyone, welcome back to all my listeners. This is episode 7 in season 12. Today is Wednesday, June 12th, 2024. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, now let's go ahead and get into today's episode. It's the second Wednesday of the month, and you know that means it's the Newsworthy feature of my OIG Work Plan update. And this time, it's for the month of May 2024. And in my Trusty tip, I'm going to go ahead and share my article on G2211. And I'm going to go ahead and close out and round out today's episode with the remarkable quote on collaboration by Henry Ford. Today's episode is sponsored by Advanced Coding Services. Let's get into it. Today's episode is sponsored by Advanced Coding Services, a leading medical billing and medical coding school in the United States. Whether you're just starting out or a seasoned professional, our training equips you with the tools and support you need to advance your career. Our medical billing and coding school meets your needs worldwide online or in person with one-on-one support throughout your training. We are committed to helping our alumni and credentialed medical community in keeping up their certifications by offering various avenues for acquiring your continuing education units. In addition to our Mastering the Business of Medicine retreats offered several times throughout the year in different parts of the country, we now offer memberships. You can conveniently earn your CEUs by attending our exclusive members-only webinars. Since our aim is to nurture and grow the careers of individuals who work in the business of medicine, we call our member area the Apple Orchard. Advanced Coding Services, educate, nurture, inspire, reaching back with a hand up. So let's get into Newsworthy, the month of May's OIG Work Plan updates. There are 8 updates made to the OIG Work Plan for the month of May 2024. Now, the first is titled Audit of Fiscal Year 2024 CMS Financial Statements. This report is expected from the Office of Evaluation and Inspections. The CMS financial statement audit determines whether the financial statements present fairly, in all material respects, the financial position of the audited entity for the specified time period. Now, this is pursuant to the Chief Financial Officers Act of 1990 as amended, and the Government Management Reform Act of 1994, and the Federal Financial Management Improvement Act of 1996, and the Generally Accepted Government Auditing Standards, and finally, from the Office of Management and Budget Bulletin 24-01, Audit Requirements for Federal Financial Statements. Now, the OIG will retain an independent external auditor and review the independent auditor's work papers to determine whether the financial statement audit of CMS was conducted in accordance with federal requirements. This final report is expected in fiscal year 2025. Now, the second OIG Work Plan update for the month of May 2024 is titled Audit of the Office of National Drug Control Program Performance Measurements and Targets Reported for the fiscal year 2023 Annual Drug Control Assessment. Now, this report is expected from the Office of Audit Services. The Office of National Drug Control Policy, the ONDCP, leads and coordinates the nation's drug policy to improve the health and lives of the American people. ONDCP is responsible for the development and implementation of the National Drug Control Strategy and budget. Now, the ONDCP coordinates across 19 federal agencies and oversees $41 million budget as part of a whole of government approach to addressing substance use disorder and the overdose epidemic. The ONDCP evaluates the effectiveness of national drug control policy efforts, as well as the strategy's goals and objectives, and each national drug control program agency's program-level measures. In the federal agency's fiscal year 2023 data reported to the ONDCP, the Department of Health and Human Services agencies reported on programs aiming to reduce overdose deaths. However, some of the related performance measures were submitted without conclusive data. The OIG will review the Centers for Disease Control and Prevention, the CDC, and the Substance Abuse and Mental Health Services Administration, SAMHSA, their performance measures and targets to determine how they were developed and reported, and whether the agencies encountered challenges implementing them. This final report is expected in fiscal year 2025. Now, the third OIG Work Plan update for the month of May 2024 is titled Unaccompanied Children Placed in Foster Care. Now, this report is expected from the Office of Audit Services. The Administration for Children and Families Office of Refugee Resettlement, the ORR, operates the Unaccompanied Children Program to provide care and placement for children without lawful immigration status who do not have a parent or a guardian in the United States who can assume custody. In some cases, the ORR places unaccompanied children into foster care. These children remain in the custody of ORR, but the foster care families and providers are generally state licensed. The OIG will evaluate ORR's use of foster care for unaccompanied children and the ways in which it intersects with state foster care programs. Now, this report is expected in fiscal year 2025. Now, the fourth OIG Work Plan update for the month of May 2024 is titled Puerto Rico Medicaid Contracting and Procurement Oversight. This report is coming from the Office of Audit Services. The Puerto Rico Medicaid program is a 100% managed care program that provides health services to more than 1 million enrollees. In December 2022, Congress provided the Commonwealth of Puerto Rico additional funding for the program under the Consolidated Appropriations Act of 2023 until fiscal year 2027. Now, this law requires the OIG to submit to Congress a report on whether Puerto Rico complied with the law's Medicaid contracting and procurement oversight requirements. The OIG will determine whether Puerto Rico, number one, complied with applicable provisions of the Consolidated Appropriations Act of 2023, and number two, if it designed, implemented, and effectively operated an internal control system for Medicaid contracts covered by this law in compliance with federal procurement standards. This final report is expected in fiscal year 2024. Now, the fifth OIG Work Plan update for the month of May 2024 is titled HHS's Compliance with Federal Regulations Related to Operating Systems and Software Beyond End of Life. Now, this report is expected from the Office of Audit Services. Operating systems, software, and applications that are no longer supported by their respective vendors and/or providers present risks to HHS and operating division, or OpDiv, networks. Threat actors may exploit a known vulnerability in unsupported software, which could lead to a detrimental result, including, but not limited to, data exfiltration, which means a loss of personal identifiable information, as well as data destruction, compromised intellectual property, and/or reputational harm. Now, the OIG will determine whether HHS and select OpDivs are in compliance with federal requirements on the usage of unsupported software. In addition, the OIG will determine whether HHS has effective oversight and mitigation controls in place to ensure that unsupported assets do not place HHS mission-critical systems and data at risk. Now, this final report is expected in fiscal year 2024. The sixth OIG Work Plan for the month of May 2024 is titled Nationwide Audits of Organ Procurement Organizations and Certified Transplant Centers. This report is expected from the Office of Audit Services. Organ procurement organizations, or OPOs, are not-for-profit organizations that perform or coordinate the procurement, preservation, and transportation of organs to hospitals for transplantation into patients who are on a waiting list to receive a transplant. Certified Transplant Centers, or CTCs, are components within transplant hospitals that provide transplantation of particular types of organs. CTCs are reimbursed by Medicare for certain costs associated with the acquisition of organs from OPOs or other CTCs for transplants involving Medicare patients. Federal regulations under 42 CFR Part 486 Subpart G include Medicare conditions for coverage of OPOs and other federal statutes, regulations, and guidance that specify Medicare requirements for the acquisition of organs. Prior OIG audits determined that OPOs did not comply with Medicare requirements for reporting overhead costs, administrative and general costs, and organ statistics. The OIG will determine whether costs reported by OPOs and CTCs were allowable, reasonable, and according to Medicare requirements, and whether OPOs met required process, performance, and outcome measures. This final report is expected in fiscal year 2025. Now, the seventh OIG Work Plan update for the month of May 2024 is titled Audit of Fiscal Year 2024 HHS Consolidated Financial Statements. This report is coming from the Office of Audit Services. The HHS financial statement audit determines whether the financial statements present fairly in all material respects the financial position of the audited entity for the specified time period. The OIG will retain an independent external auditor and review the independent auditor's work papers to determine whether financial statement audits of HHS and its components were conducted in accordance with federal requirements. The financial statement audit is required by Chief Financial Officers Act of 1990, as amended by the Government Management Reform Act of 1994, and performed in accordance with generally accepted government auditing standards, and the Office of Management and Budget, the OMB, Bulletin 24-01, titled Audit Requirements for Federal Financial Statements. Now, the audited consolidated fiscal year 2024 financial statements for HHS are due to the OMB by November 15th, 2024. The OIG plans to perform a number of ancillary financial related reviews pertaining to this audit of the fiscal year 2024 financial statements. The purpose of the ancillary financial related reviews is to fulfill requirements in OMB Bulletin 24-01 in sections 6.1 through 12. This final report is expected in fiscal year 2025. And the eighth and final OIG Work Plan update for the month of May 2024 is titled Audit of the Department of Health and Human Services Progress Towards Compliance with the Geospatial Data Act of 2018. Now, this report is expected from the Office of Audit Services. The President signed into law the Geospatial Data Act of 2018, the GDA. Now, this GDA fosters efficient management of geospatial data, technologies, and infrastructure through enhanced coordination among federal, state, local, and tribal governments, the private sector, and academia. The GDA establishes responsibilities and reporting requirements for covered agencies. Additionally, the GDA requires the Inspector General of each executive department or the senior ethics official of each executive department without an inspector general to submit to Congress not less than once every 2 years an audit of the collection, production, acquisition, maintenance, distribution, use, and preservation of geospatial data by federal agencies. The purpose of this audit is to determine the Department of Health and Human Services progress towards compliance with the GDA. This final report is expected in fiscal year 2024. And now it's time for my best practice tips in Trusty Tip. I wanted to go over my latest article that was just published in AAPC's The Magazine, the June issue. And I'm also featured on today's AAPC's Social Hour on Facebook Live, going over my article as well. So I'm very, very excited to also talk about it on my Trusty Tip for today's podcast. Now, my article highlights the guidance that's been provided by the CMS for billing that code, that G2211 code, appropriately. Now, I know all of you in the audience might have been aware that G2211 has been the hot, newsworthy HCPCS code that all providers think they can bill for. However, it's really important to remember that this HCPCS code, although it's been issued for a number of years, it is now finally allowed to be billed out and receive reimbursement. However, this is a Medicare code, right? CMS released this code as a HCPCS code, and it's available to our providers who bill for Medicare. Now, in general, in my opinion, I see this code as finally serving the internal medicine specialty. These are the physicians who follow and care for their patients for years. They are known to build relationships with their patients based on effective communication and trust secured over time. Now, that's a direct quote from my article. Now, CMS specifically has provided a little bit of guidance, which I find a lot of clarity on. So I'd like to read to you a little bit more from my article that CMS does indeed provide 2 examples for when a practitioner may appropriately bill HCPCS code G2211 per a article that they disclosed, AMM number 13473. Now, I'm going to read to you about this second example because I think it really pinpoints and highlights very well the type of patient population that could be involved in the application of this HCPCS code G2211. Now, CMS states in this second example, they use an established HIV patient who is seen in the office by an infectious disease specialist as a situational scenario. This example is easier to grasp because the specialist is part of the ongoing care for a single serious condition or a complex condition such as HIV. Now, the patient also discusses non-adherence to medication doses, possibly due to forgetfulness, not due to the side effects of the medication. Now, if this ongoing relationship between the specialist and the patient did not exist, the patient may not have entrusted the physician with this information, and the specialist may have prescribed another HIV medication with greater side effects, not realizing there was no issue with the original medication. This example, in my opinion, emphasizes the complex relationship between doctor and patient that warrants the use of G2211. So definitely check out my article in this June issue of AAPC's The Magazine, and hopefully you guys can tune in to AAPC's Social Hour on Facebook Live later today. And finally, I focus Season 12 Spark on collaboration. I want this 12th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for collaboration. So, in this week's inspiring quote in Spark is from Henry Ford. Coming together is a beginning. Staying together is progress. And working together is success. So very true, right? This quote says it all, doesn't it? This quote reminds us that coming together is just the start. This quote encourages us that staying together is a step in the right direction. And this quote drives home the fact that our collaborations together are some of our greatest success stories. I'm happy Henry Ford's spark still burns brightly in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Now, all right, you guys, remember to catch my LinkedIn Live broadcast on Friday for my latest episode of Compliance Capers with my very good friend and colleague, Betty Hovey. We have started the month of June off talking about CMS's Targeted Probe and Educate program, the TPE program. And this week, we're going to be focusing on a current evaluation and management TPE. And don't forget, it's also on my YouTube channel for Paint the Medical Picture, so you can always check out the replays there. Now, I wish you guys all an amazing and very, very happy week ahead. Thank you so much for listening on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.